Hello, this is Dr. Tariq Saadi. I'm a general practitioner dentist at my own private clinic in United Arab Emirates. I'm utilizing the digital technology for more than 5 years now. We'll go through all these topics during my presentations, so please, if you have any more inquiries, you can contact me through my social media channels. I would like to start with this slide. It's really important for the ones who would like to purchase a scanner to know the difference and what's the criteria they need to follow to take a decision and get a scanner. So we are the online generation where everything is single touch away from us. For our patient, they will come to our clinic looking for a treatment with their expectation, high quality treatment in short time and less cost. And for us to be able to compensate or to be able to give the proper treatment for our patient from aesthetic wise, function and longevity as well, we need a tool, we need a way to be able to communicate with our patient, plan our cases, show them the final outcome, and get the final approval and increase the patient acceptance. So to be able to do that, we need a time. That means we need a way to digitalize our patient data and store them in our PC. So later on, we can start planning our cases, can get a second consultation from our colleague, show to our patient, get the final approval, and increase the final outcome quality. So digital dentistry doesn't change the type of information. The only thing it's changed the type of or the format of that information. So instead of get analog or traditional impression, we can digitalize our impression and get the STL file. And instead of getting 2D photo, we can digitalize and capture a 3D face scan. And as well, we can utilize the hard tissue of our patient by getting the cone beam CT. So now we have three different files, three different format, and to be able to build our virtual patient, we need a way to integrate all these type of formats and stitch them all together to be able to have our virtual patient. So we'll go through the steps how you can stitch and integrate all this information together. First of all, you need to use your 3D face scanner, scan the face, add some landmark and scan the face. Then next, you can crop that smile utilizing the software tools. Remove the smile because later on you need to replace that one with the intraoral scanner. Then next, you need to scan the face with a bite restoration material and make sure that bite restoration material has as well the landmark. So you have now two face scan. The first one without bite restoration and the second one with the bite restoration. Now we'll go to the intraoral scanner, scan the jaw with that bite restoration, the same one which you use it to scan the face, and another scan without bite restoration. So now we have two intraoral scan, one with for the bite restoration and the other one without the bite restoration. You can scan the lower as well and add the CBCT from your CT machine. So through this video, I will go step by step for the integration. Starting with the intraoral scanner. The nice thing about Trios software that you can utilize a really fast scan in very short time, and as well you have a tool where you can capture not only the bite, you can capture as well the patient's specific movement. So you can just, while you are recording the bite, ask your patient to move the jaw to the right side, left, protrude, retrude, and all this motion will be recorded. Now we'll start the integration. So both scans, the one with bite registration and the other one without, just find some landmark and the software automatically will integrate both of them together. Now use that bite scan to integrate it with the face, which is has the bite. Again, add some landmarks and the software will do the alignment. Remove that face and add the cropped one. Align both of them using the face landmark. So now you have all these two scans integrated and stitched together, the face scan with the intraoral scan. Later on you can add as well the CBCT, and in the same way you can just find the landmark and integrate the intraoral scan with the CBCT scan. So now we have three files, all of them integrated together and stitched together. Once you are done with this stage, you can start the planning for your case. You can use the patient-specific movement for bite record, so no need anymore to use the preset virtual articulator. You can use the same parameter which comes from the patient himself. So I would like to highlight one very important point, that digital dentistry, it's a learning curve. You need to enhance your experience, you enhance your background by attending courses, do trials, learn from your failures. In the end, you have to build yourself and be ready for that evolution. I would like to thank all of you. This is the part one of my presentation. Later on, we'll go through some simple and advanced cases.